Welcome to the TMB podcast. My name is Abdullah,
I'm Ashraf.
and today we'll be having Shaik or Dr. Shaik joining us for the podcast. And we'll be talking about medicine, in particular the course.
Okay.
Yes, hi Shaik, how are you?
Hi, I'm well. Thanks for asking.
Okay, so to intro Shaik a bit, Shaik is our secondary school friend. We've known him for more than half our lives. And he has had a very interesting journey up to now in his life. He's a doctor now. And today we'll be discussing more about his journey in medicine, as well as how he studied medicine in university and what he's doing now. So,
Yeah, so Mr. Shaik, do you want to... Oh, sorry.
Dr.
Shaik.
Okay.
Dr. Shaik, do you want to have a short intro of yourself? Maybe focusing more of your studies and just what you're doing right now.
Okay. My name is Shaik. So I refer to myself like in the singular, without the superlatives and extra titles.
Okay.
So I guess right now I'm doing urology at Changi. I've been working since
Changi General Hospital.
Changi General Hospital. Been working for about a year and a half now. Coming on 2 years soon. I graduated last year, 2021. Yep. Oh, what?
This year is 2021.
This year is no, dude, no, it's not. I graduated in 2019. I'm sorry, my bad. Yeah. Well, that's about it, I guess. I mean, medicine wise. Before that, I did 5 years of medical school. I went to NUS Yong Loo School of Medicine, purportedly Asia's leading medical school.
Oh, wow. That's crazy.
Purportedly.
Okay.
Yeah.
Okay, so now that we've heard more about yourself, we do have some questions prepared for you. So, okay, firstly, the first one is basically an introduction. So you just told us briefly you're from NUS Medicine, and right now you're working in your first year?
Second year.
Second year already, right? Yeah, so can you share with us how the medicine curriculum is planned out in NUS Medicine specifically? Like, let's talk about it in general from M1 to M5.
Okay. So NUS Medicine, I think it follows a structure that's quite similar to how most other medical schools do it. So the first 2 years, M1 and M2, is generally more academic. There's a little bit of clinical exposure, but the majority of it is built around building a strong academic foundation to understand general core principles. So I mean, in the first year, in general, you learn about normal things. So you learn about normal anatomy, normal physiology, how things work, how systems work, how your lungs work, how your brains work, how your heart, liver, all these other systems work. Then moving on beyond that, in your second year, they focus more on things that are abnormal. So you learn topics like pathology. So I mean, how things and different organ systems can go wrong. Pathology is sort of like the converse of physiology. So what can go wrong and how, like when things go wrong, how it looks in terms of the clinical manifestations of the disease, how it looks histologically in terms of how the cells look, things like that. Then, I mean, there's also, I guess, microbiology, which we also learn in our second year. I guess infection is a pretty common thing that you encounter in medicine. So I guess it's important to learn about different types of bacteria, microbes, and other organisms and how they might afflict you and how they might present themselves. And then there's other small things as well, like immunology and like more specific things. So after you're done with your first 2 years, the curriculum becomes a lot more clinical. So I mean, there are still exams and lessons, but the majority of your time is spent in hospitals and the wards during your various postings. And then the exam just sort of helps you sum up the knowledge that you've learned and apply them in a in a academic setting. Yeah. So I mean, in your third year, I mean, you learn the bigger topics. So I mean, there's like general medicine. In NUS in particular, we do 8 weeks of general medicine rather, and 8 weeks of general surgery, 8 weeks of orthopedic surgery, and then after that, yeah, I think those are the main postings in the third year as far as I can remember. Then after that, there's electives, which most NUS students will use as an opportunity to do something that they might be interested in, which isn't covered in our core curriculum, or Some others might try to do things overseas to get a good break and get a brief experience of how like medicine is practiced elsewhere. Because otherwise, the majority of our curriculum is quite focused on how we do medicine here, which is important because I mean the far majority of students that graduate from NUS will be applying the things that they learned here. Not only in like how we practice, how we deal with certain conditions, but what's prevalent here, what patients prefer here, what they understand and experience here. Yeah. I mean, it's also good to learn how things are done outside so that you can also bring the experience that you've learned and apply them in our own setting also. Yeah. In the fourth year, it's generally smaller postings, things that are not as core but are good to know, fun to know. Things like eye, ear, nose, and throat, pathology, pediatrics. Or pediatrics is a year 3 posting, excuse me. But they've moved it to year 4 because it's a bit less core. Yeah, things like obstetrics and gynecology, anesthesia, all 4th year postings. So I 4th year is supposed to be a little bit more relaxed than 3rd year, and then just as a sort of give you a short break before your final year where you need to sort of coalesce everything you've learned and try to add it up to be a good doctor essentially. Yeah.
Okay, so actually you've talked about the first 4 years. So in the 5th year, do you still have postings or
So
what's the difference?
In the 5th year, you still have postings, but the majority of it is revision postings. So it's postings that you've already done before.
Okay.
But they just make you go through it again. But this time it's a 5th year medical student. And there's a heavy emphasis on what they call SIP, a student internship program. I guess like one reason why they started it was because they realized that a lot of students like who transitioned from being just normal students to being doctors on their first day didn't know how to be functional doctors. Like there are a lot of things which are not necessarily academic or book smarts or like recognizing diseases, understanding patients. Like this, we have plenty of experience doing in our clinical years. But things like how to order medicine, how to circumnavigate the hospital environment with all its people, its nurses, all your allied health personnel who you would have to interact and communicate with as well. So that's sort of the purpose of M5. And then, of course, it leads up to MBBS, which is a month-long exam, which everyone dreads and is glad it's over.
All right. So I'm guessing you did well for MBBS.
I did okay, actually. I mean, to be perfectly frank, I mean, I didn't do amazing. I'm not a medicine with honors or anything. Although those are pretty few and far between.
So do you want to share with us which postings you actually did from M3 to M5? Or is it too much?
Oh, I mean, actually everyone in NUS does the same postings except for their electives. So, I mean, I guess the only difference that people in who do medicine will have in terms of their postings and what they learn, it can be quite varied as well, but it will be sort of dependent on one, the hospital that you end up doing your posting in, and then two, the supervisors and people that you meet there. Because, I mean, the staff that train you are generally clinical staff. I mean, they are not generally like specialists in education or anything like that. They do their best to impart you with knowledge. And I guess one interesting thing about medicine is that it has a very strong culture of pedagogy, as in that they try their best to teach juniors and to ensure that the next generation of doctors know what they're doing and are good doctors in general. But I mean, they can be quite different in terms of their specific fields of interest, maybe like the kind of practice that they do, what they think is important for a junior doctor, what they don't think is important. So, I mean, for me personally, I mean, okay, my first posting was Changi General Hospital Internal Medicine. Then I think I did orthopedic surgery at NUH. I did general surgery at NUH as well. I did pediatrics at NUH as well, and KK. That was I did peds at KK. Excuse me. I did peds at NUH in my 5th year as my revision posting.
Okay.
Yeah, so that was essentially my 3rd year of medical school. Of these, I mean, like each of them have like their own lessons, own experiences. But it's quite a big topic, actually. I mean, is there anything specific that you wanted to ask about?
Maybe you can have that for another time through a more in-depth interview. But actually, I want to talk about, you mentioned all this, your supervisors or professors actually wanting to spread their knowledge or guide you in your journey to be a doctor. So from what I know, for NUS medicine, you also have housemanship which is basically having a group of like a house. Basically, or do you want to talk about what housemanship is actually?
Oh, I think what you're thinking of is as in like houses that they split us
houses.
in
Yeah, it's
in
different.
our lower years. Oh yeah, housemanship is like the first graduate year that we do, which is quite.
Okay, sorry.
No, it's okay. It's okay. It's sort of like a internship year, like a P-plate year where you don't have your full registration yet. But anyway, houses in medicine.
Yeah, houses in medicine.
So houses in medicine is a new-ish thing as well. So essentially, at NUS, I mean, our batch is 300 people strong. So they split us into 10 houses of 30 people. So it used to be that, I mean, these are just the people that you go to lessons with or you go eat lunch with. It's sort of like, you could look at it as like classes that you would have in JC or secondary school. But also because our batch is so big, our lecture theatre is so large, I mean, people end up just sitting wherever and they meet a lot of friends from other houses. So the houses aren't really a strict group of people per se. Later on, in my second year, I think, they built a new building, MD1, and then in MD1 there were specific house rooms, and I guess that sort of made it more clear who was in which house, because I mean you could only tap into your own house room, so people would like, hang out in their house rooms and do different things. Like different houses had different things. Like some houses, like they brought in gaming consoles. Some houses even had a pool table, that kind of thing.
Okay.
So I guess that sort of sets the vibe of your house. The main purpose of making houses, I think, initially was just so that people have a good base of support, peers that they can ask questions, peers that can help support each other through the no doubt difficult task of, I mean, earning an undergraduate education.
Do you also have seniors who actually mentor you or guide you as like if you're just starting out as an M1 student?
Yeah, so they also have what do they call this? Yeah, I think they just call them mentors if I'm not mistaken.
Mentors?
Yeah, but but anyway, so you get more or less you just pick your own mentor. Generally, it's from the house of the batch above you.
Yeah.
And then I mean, you just ask them for things like notes and like how to study for certain things, what to prioritize. Generally, very academic things, just how to navigate your lower years.
Okay.
I guess it's really different pair to pair. I mean, some mentors and mentees are very much closer, who still hang out and things like that. For me personally, I mean, like occasionally I'll ask my mentor for things, but we didn't really have a that close a relationship, I guess. Yeah, so it was just general academic.
So moving on to the academic part, right? So can you tell us more about the written exams, the practicals, and the grading system? How do you study, practice, and what happens if you fail? And all these sorts of things. Can you walk us through all of that?
Oh, okay. So I think it works quite similar to how other courses work in NUS also.
Really? How would you know?
I mean, just based on asking my other peers. So it's slightly different in the sense that we don't have like a formal GPA or anything like that. In US, I mean, medicine isn't modular. So all the courses and modules are sort of set up for you and everyone has to do the same things. In terms of grading, just broadly, generally there are 3 or 4 main exams throughout the year, continual assessments and then end of year assessments. And then you generally get like a pass grade or a distinction. So as a pass fail or distinction. So most students, like the far majority of students would end up just getting a pass grade. And then very fewer than 10% will get a distinction grade. And then they'll end up being dean's listers and all those things.
And this starts even for your first and second year of medicine?
Distinctions, you can start getting distinctions and getting into the dean's list from your first year. That's right.
Okay.
Yeah.
I didn't know that. Then I thought you also had like grading system later on in your medical journey.
So actually, you do get a grade, and for every posting that you do, and then I mean, each of these grades in your third year and all, it sort of forms a continual assessment and then combines with your MBBS grade, and then that ends up with giving you a grade for medicine and surgery, pretty much. Yeah, and then at the end of your cert, I mean, just says whether you got like a merit distinction, that kind of thing.
So
Okay.
okay, so the final the final grade that you'll get is either distinction, merit, or pass.
Yeah.
So the majority of people, I would assume, fall under the merit category.
I think the majority of people will get a pass, I think. Actually, I'm not 100% sure. I'm a bit fuzzy on it. But to be perfectly frank, it doesn't really matter because everyone is bonded anyway. So everyone has a job anyway. So everyone is going to start work anyway. Yeah. Like, it stopped being the case that in our year we would be able to apply for things like residency and specialist training from within our medical school careers. So now, I mean, everyone is obligated to finish their first year of housemanship at least before applying. So generally, how you conduct yourself during that year, what your peers and seniors think of you, what kind of letters they want to write for you, and like what kind of research that you've done and your other academic accolades. Generally, those play a bigger part towards your chance of getting into specialty programs than the specific grade that you get, at least as far as I understand.
So what happens in a specialty program?
Different specialty programs work differently. Some are longer, some are shorter. So it's really quite specific. But generally, as a rule of thumb, I mean, it's meant to train you to be a specialist. So you go through postings that are related to your posting and also like your posting specifically itself. And then you to learn both your own specialty and things that are para your specialty. And then after that, they also help you have like, they guide you like when to take exams, and then there's like specific lessons to help you improve in your understanding of your own specialty and also to help you take your exams also.
Okay, so sorry, para, your specialty as in they are similar, related to your specialty, right?
Yeah, similar. So like for example, let's say you want to be a general surgeon, then generally your postings will include, of course, general surgery, but you also do a little bit of orthopedics, a little bit of anesthesia, so that, I mean, you understand like how ICU works, for example. You know what kind of drugs you can use, how to intubate patients, how to manage critically ill patients, and then also how to do your own thing, which is surgery. Yeah.
So it's basically similar but not congruent fields.
That's right. Yeah. So that you can, understand a little bit and take a little bit away from them.
So Shaik, before we get into any discussion about how you studied medicine in NUS, can I just ask you a few questions about your interest in medicine? So my first question would be, how did you know that you wanted to pursue medicine?
Okay. I mean, I think that medicine was, I guess inherently, I always wanted to do something good, something that I could do physically, personally, with me and another human being. And I think that there's hardly nobler a pursuit than caring and treating another person. I mean, from a religious perspective, also, I think something very special that, I mean, like care, I mean, health and all that, like, I mean, comes from God. But then it seems like something very special to be able to play a part in that process. When did I know for sure that I wanted to do medicine? To be perfectly frank, it was really only in JC when I felt that I could do it. When earlier on in secondary school and things like that, I mean, dreams like this seemed very far off. But I mean, I guess in JC, I felt that I had good momentum, that I was doing relatively well academically, and I felt that I was really finding my footing. I felt that it was more of an achievable dream. So I mean, at that point, I think I set my gears towards it much more strongly.
Okay, so if I may speak to the application process itself. So were grades a big factor in the application process, and how did you prepare yourself for any interviews or assessments that they had for you?
So grades are undeniably an important factor. I think it would be difficult to get into medicine with less than good grades lah. I mean, I think at this point they're trying their best to also create a more varied environment in terms of the diversity of the kind of students that they admit to NUS. It used to be that, I mean, the far majority of students would be from GCs, but I think now they're making a greater effort to also include students from different backgrounds, like such as those with madrasah backgrounds or those from polytechnics. So I would say, I mean, grades are definitely important, and students who are thinking of applying shouldn't discount the importance of grades. How else did I prepare myself for interviews? So there were a few things that I did. I mean, I went for a few attachments. I think that going for these attachments are important, not so much just to beef up your resume, but more so that you know what medicine really entails, like what's involved and what is required of you to be a doctor who works in the Singapore healthcare system. I mean, the last thing that they want is to dedicate such a long time and so many resources into training a medical student who becomes a doctor, who then realizes that, this isn't really quite what they expected, this isn't really quite what they want, and then they just quit. Yeah. So, I mean, ultimately, I think that anyone who shows that they have a penchant for it, who understands that this is what is expected of them, this is what is demanded of them, that it isn't all glory and riches, I think that's probably the most important takeaway to any attachments that you do. Beyond that, I also spoke to a few people, spoke to a few doctors, namely the ones who I did my attachments with. I think that was helpful also in like giving an understanding of the interview process and what they were looking for. And then I guess that helped me prepare in terms of how I will answer certain questions as well.
So just to clarify, you actually had attachments, clinical attachments with doctors that you knew?
So I guess I was relatively fortunate. The very first one I went for was an attachment organized by a senior. His name was Arif. He didn't come from VJ, but anyway, I mean, he at the time he headed this program called the Muslim Healthcare Outreach Program. I think that was the first year that it ran. So I mean, it reached out to various junior colleges to look for Muslim students to try to help them get a better feel of the application process, to try to help them in their application process, essentially. The reason why it was done was because, I mean, actually in medicine, there are pitifully few. In the batch above mine, there were a fair number, but in the batch above that, there were 0 Malay Muslim students. On average, you'll find that there are 6 Muslim students or Malay Muslim students out of a batch of 300, which is relatively far below. I mean, what would you find proportionate in terms of our population? Yeah. So I mean, through that, I mean, he helped to arrange for a clinic job shadowing kind of program, which I ended up doing, which ended up being my grand aunt's clinic anyway.
Oh, so you actually had connections?
Yeah, I guess to an extent.
Grand aunt,
yeah.
sorry.
Yeah, my grandmother's sister is a GP, and then she has a clinic. Yeah. So I mean, MHOP, like Muslim Healthcare Outreach Program, was in part backed by a greater association or group of Muslim healthcare providers. So I mean, through that, I mean, they source for which doctors are available to coach students or to mentor them, so that they can provide the resources needed for these students. So I mean, beyond that, then I also did another 2 attachments, one at KK and then one at Alexandra Hospital as well.
Okay, so finally, after you completed all these assessments and interviews and you finally gotten an acceptance letter into medicine, so how did it feel to you personally when you received that letter, and what was the reaction of your family members, and how did they receive this news that you got into medicine?
Well, I think it was amazing. I mean, it was really great. I remember, I mean, like, it was a Friday. I mean, I knew that the application results would be released in sometime in May, sometime after Labor Day. That's generally when it's released. The interviews and all that take place in March, so that's a month plus of, I mean, trepid excitement and anxiety. So yeah, it was Friday after Salat Jumat at Masjid Maidin with my dad and my granddad. And then, I mean, I remember during the prayer itself, I mean, I was praying that, hopefully that things would go well, that whatever is good for me would be for me. And I mean, if entering medicine and becoming a doctor is what's meant for me and what is the most beneficial for me, then let it be so. And then, I mean, then after the prayer, I mean, I looked at my phone and then I saw that I received an email from NUS congratulating me. Congratulations, I mean, Shaik had been accepted into medicine. Yeah, that's really good. I mean, and of course, my parents and my grandparents and my families were all very proud and excited. I mean, my grand aunt is a doctor as well, and so is one of her sons actually. But I mean, within my more immediate family, I mean, it's really just me. Yeah. So I mean, they were all quite proud and excited.
I mean, you're not the first person in the family to be working in a hospital, right? As far as I know. I believe your mom is also a nurse in one of the hospitals, public hospitals. So did her being a nurse actually play a role in your pursuit of medicine?
I think yes and no. I mean, my mom's been a nurse for the longest time. I mean, I think it's her first and the only job that she's had. So I mean, she's worked a very very long time at her job, and I think that I admire her work ethic. The stories that she brings back are quite interesting as well. But she sort of always left us to pursue our own interests and our own talents, and guide and let us be guided by our own talents rather. So I mean, to an extent, not really. I mean, I think that doing medicine was really something that I wanted to do personally.
Okay.
But she's always been supportive of that.
I'm also very supportive of.
Oh, that's very nice of you.
Okay.
Shaik, now that you've graduated 2 years ago, how was it like on your first day on the job as a doctor?
Okay. So I remember quite clearly my team. Can't remember exactly what happened on the first day. I remember being very confused. I mean, going into a new hospital environment, no longer as a medical student, but now as a doctor, quote unquote. I mean, I've never been called that before. It'll be my first day being called that.
Really?
Being called that by nurses, being called that by patients who need my assistance, doctor this and doctor that. And I would just be, I don't know. You would think that 5 years of medical school would prepare you for being a doctor, but really there's really so much to it. A lot of it is really functioning, is in how hospitals function. And CGH in particular at the time was still paper notes. So like how you would write entries, like what your daily tasks are, what seniors expect of you, what nurses expect of you, what patients expect of you. So it's really quite a lot to grasp and learn. So the first day was quite overwhelming. It felt very lost. It just felt like a fish out of water, really. But thankfully, I mean, in general medicine, I think general medicine is a good place to start because your seniors are always around. So you start as a house officer in your first year. That's like the pre-full registration kind of state that NU students graduate with before they get their full registration a year later. So in general medicine, there's your team is made up of house officers, medical officers, and then there's your registrars and your consultants. But the good thing about general medicine is that your medical officers are always around in the ward with you. So if you have things that you want to ask, even if it's things that are silly like administrative things, how to document this, how to write this and that, how to order medicine, how to order investigations, for example. And those are just how to use the system. Even if you know what drug to order, it can be quite difficult. So yeah, thankfully my medical officers were very kind and guided us through and understand that we were all very, very silly first day human beings.
So can you speak more about your work schedule? How was it like?
So work schedule wise, it can be generally when you first start, you always end up staying very late. You end up staying very late to try to understand like what your patients have, to try to prepare yourself better for the next day, to try to catch up on things that you might have missed, make sure you didn't miss anything, just go through a list and check it twice, that kind of thing. But as you become more experienced, then you can afford to leave a bit earlier, come a bit later in the morning, since you're a bit faster and more efficient. Generally, when I first started, I remember I would come at 6:30. I'll leave maybe 7, 8 at times, sometimes even later. At the time, I mean, my the person that I was seeing was also doing general surgery in Changi. So I guess I should always have to stay very late, much later than I did. So in the end, I just stayed and did my own documentation and things like that at the end of the day.
Yeah. So you started off in general medicine in CGH, right?
That's right.
All right. So your hours are actually should be from 6:30 till 8.
So by right, I mean actually my hours are supposed to start, I mean, around 7:30-ish, maybe until 5:30 probably. Beyond that, it's supposed to be on-call time. So if there's anything that occurs outside of those times, the doctor who's on call is supposed to settle it by right. But oftentimes it's quite bad and mean to hand over things that you could do and that you would be able to do more easily than a doctor who has never seen the patient. So generally you try your best to finish whatever things you can before going back.
So in your first year as a fully fledged doctor, you're considered a HO, right?
That's right.
So a house officer.
That's right.
So this is only for your first year, and do you still have to go for, as you mentioned, you have to go on call? This is something that I feel like you've always mentioned when we cannot hang out.
Oh.
Yeah, so what is it actually?
Oh, so on call is generally when you work the day So that's your normal working day. And then after that, you are on call for the night, which means that if anything happens to a subset of patients that fall under your care overnight, then the nurses will call you to do something about it, essentially. So then you go on call throughout the night, and then hopefully 7:30 sun rises, and then your call is over. Then when your call is over, then you resume your normal work for the day, the next day. And then hopefully if you're lucky, you get to leave a half day, maybe like 12:30, 1-ish. If you're not so lucky, then you might not end up leaving on time.
So that's post call, is it?
That's post-call. That's right.
So after you're on call, then you have post call, which is you get to leave at half day. So essentially, you're working for 36 hours. Straight.
If you were to leave at 12, you probably work about 30 hours, like 24 hours plus another 6 hours half day. Yeah.
But then you have to work the following day?
The day after that?
Yeah.
Oh, yeah. After that, it's just a normal day.
Oh, wow.
That feels bad, man.
Yeah, feels bad, man.
Yeah, it's a feels bad. It takes a lot of getting used to. I mean, when I first started, I just couldn't wrap my head around why there's such a system. Like, who came up with this? Who thinks it's safe to work 30 hours at one go? I mean, actually, after 24 hours of sleep deprivation, I mean, your alertness is equivalent to a blood alcohol level that it would be illegal to drive at. So,
Do you drive in your first year of HO?
my first year of HO, no, I took the train.
Okay,
I
good.
took the train
Good,
most of
good for the
time.
public. Okay, so let's not talk about the MOM laws in place for doctors. But after 1 year, you move on to MO, right?
That's right.
So what's the difference between medical officer and house officer?
So it depends where you go. So I mean, when you're a house officer, there are only certain postings that house officers do. So house officers only do general medicine, general surgery, orthopedic surgery, and pediatrics, and obstetrics and gynecology. So only these 5 postings, essentially. So anything outside of that, there are no HOs around. So when there are no HOs around, then as the most junior doctor, then you become the HO anyway.
Like a MO, but actually HO.
Right, actually HO, that's right.
Right, okay.
Yeah, so I mean, for me personally, my first posting, I was in A&E as my first MO posting. So in A&E, I mean, there are no HOs around because you need a full license to be an A&E physician. So I mean, essentially you just see patients, and then after that you do all the grunt work, like whatever the senior tells you to do, then you just go and execute it. So you don't, I mean, you should have some clinical acumen so you can present a good history, you can take a good history, you can do a good exam. And after that, you present your findings to your senior, your consultant, and then more or less they'll make the decisions. I mean, you can offer your plan, but generally they'll tell you what to do if you go astray.
So as a HO, you actually don't have a full license, is it?
No, you have a provisional license. So your medical registration number has a P in it. So you're like a P-plate doctor.
Oh no, that's terrible. Okay, so from my understanding, you only have a posting for 6 months. So as a HO, you have 2 postings before you move on to MO. Is that correct?
So as a HO-ship lasts 1 year. It generally constitutes 3 4-month postings.
Oh, 3 4 months.
Yeah. So you need to do medicine for sure. And then 1 surgical posting, either surgery or orthopedic surgery, or either general surgery or orthopedic surgery. And then the last one can be anything else.
Okay.
Yeah.
Okay.
Yeah.
Okay, so now that you've been a doctor for close to 2 years already, right? And you are on the other side of the table as opposed to previously being a patient. So what are some things that you wouldn't know or misunderstand, some things that people misunderstand about doctors that you now feel that you can relate to more?
Oh, lots of things. I think that, I mean, expectations are a huge thing. I mean, when you go to the hospital, you sort of expect that, you know, like, my condition is, for example, I guess I've only been a patient once or twice prior to becoming a doctor. But I mean, I think it's most pertinent to when you see family members go to hospital. You know, when you see a family member admit to hospital, you're very frightened, you're very worried. Oh no, he's in hospital. It must mean that he's very ill. Something urgent must definitely be done. Why hasn't the doctor seen him yet? Why aren't these scans being done quicker? Things like that. But I mean, now being on the other side of the table, I guess I understand what's urgent and what's not urgent. I understand that, you know, a doctor might not necessarily see you right away. And if he hasn't, then I mean, you do not need to worry too much. In general, I mean, there's always someone looking out for you, like the nurses there to make sure that you're okay. If you're actively dying, hopefully they'll call the doctor. Yeah, that kind of thing. So I think a lot of it is really just how not to be too anxious in a hospital setting, particularly for when family is there. And I think also it's given me a better idea of how to understand medical issues and ailments that might occur, particularly in family members. I guess it gives me a better appreciation of what's happening to them and what I can expect to happen. I guess, for example, I mean, my grandfather, I mean, he was recently admitted to hospital. I mean, yeah. So that was a pretty terrible and stressful experience. I mean, particularly towards the end when he eventually passed away. But I guess, I mean, being a medical person now, I would understand the reason for the decisions that the doctors had made, the challenges that they would have faced in coming to those decisions. Because a lot of the decisions that we had to have made at that time were certainly not easy, and there were a lot of things to weigh. So I think, I mean, being a doctor now, I think that those are my two main takeaways. Just understanding what's happening and understanding that, you know, things might not be done super quickly, but don't worry, everything's okay. Yeah.
So right now, do you feel particularly confident in the job that you're doing as a doctor after this 5 years of studying and 2 years of working as a fully fledged doctor?
I think, I mean, generally the healthcare system is structured such that there's always someone around that you can ask as a junior doctor. So I feel relatively safe in the sense that, I mean, I know that, you know, if something happens and I know that I'm out of my comfort zone, or this is something that's above my expertise, there's someone that I can escalate issues to, someone who I'll be able to ask to help assist or help handle the issue. So I guess I feel quite comfortable operating at my current level. I mean, I'm relatively junior still. I'm only 1.5 years in. There's loads to learn. Medicine is so broad. So yeah, I mean, I look forward to learning more and being better.
Speaking on that a bit more, do you ever feel that you've experienced imposter syndrome while working?
Oh, imposter syndrome is in.
As in Among Us.
It's like, you know, like you feel like, what am I doing here? I don't belong here. Like I'm just winging my way through everything, and I don't know what I'm doing here. This kind of thing. Do you ever experience this kind of episodes?
I don't think so. I think in general, I have quite a secure understanding of what I am. And I mean, in a hospital setting, like, I know that I'm a junior doctor. I know that I don't know everything. I know that there are some things that I can do and there's some things that I cannot do. And regardless, I mean, there's always a way for me to help the person in front of me. So I think, to me, that's enough to be able to practice and be competent at what you're supposed to do.
Right, Shaik. So now we're going to move on to the final segment of this conversation with you. So I'm just going to ask you a few questions. Doesn't have to pertain to anything medical or anything.
Sure.
So, what would you have done if you had not been accepted into medicine?
What would I have done? I would have been very sad. No, I'm just kidding. I think that if I wasn't accepted into medicine, then I guess I would still have another year of NS to think about it. Because I mean, in my first year, actually, I only applied for one course to one university, and that was to NUS Medicine.
Oh.
So I mean, actually, if I didn't get it, then I would have to apply.
Put all your eggs in one basket, right?
Yeah, I guess because that was the only thing that I really wanted. Everything else was okay. To be frank, I didn't really give enough thought into anything else. That was the only thing I wanted, and alhamdulillah, I got it.
Do you?
Did
Sorry.
I? Yeah, go ahead.
Continue.
No, I was going to say.
Oh, do you tell your interviewers that you only applied for one course, so you better get in?
I didn't. I'm not sure if they can see it on the back end. I'm not sure if that helped.
It's a huge gamble.
Yeah, man.
Huge
I guess, like, especially for guys, it doesn't really feel like it though. I mean,
Because we have 2 years.
because we have 2 years anyway in NS. So I mean, even if you are not successful in your first application, then you can always apply next year. Whereas for girls, if you're unsuccessful in your first application, then that's a year lost.
You can take a gap year.
I mean, yeah, you would be forced upon a gap year really.
No, it's a choice.
Yeah. I mean,
Okay,
so I think if
yeah.
not medicine, maybe something paramedical, where I would still be able to help patients, but probably not in the same capacity. Maybe something like an occupational therapist or a physiotherapist. I think that they do really good, really important work. They have a good work-life balance. They do, and I mean, their interactions with patients can be very meaningful and very special, very wholesome. So I think it's good stuff.
So I'm curious about one thing.
Yeah.
So during the interview process, was there a particular question that they asked most of the students applying for medicine, and how do you answer it?
Okay. So there's in NUS in my year, it was a station-based interview. I think that was the second year that they were doing it. Since then, they've revamped the system, so this knowledge
outdated
is no
info.
longer current. Yeah, that's right.
No. Okay.
Essentially, it was short stations. Each station is like 7 minutes, so they give you a specific task or specific question or specific prompt, and then you respond to it. So one of it is like a personal statement kind of response. So you discuss your personal statement. I mean, the examiner reads it and he gets an idea of what you've written, and then tries to from it get an idea of what you are. And then he asks you questions about why you want to do medicine and things like that. But the rest of the questions or interviews they seem to be focused more on ethical principles. So I mean, there's things like let's say one of your coworkers, like they do something wrong, like they give the wrong drug or the wrong dose, and nothing happens, but they try to cover it up. What would you do? I guess these questions are designed to help you display some degree of professionalism, to help you help the examiner assess like what your ethical principles might be, or where you might lie in the ethical spectrum, really. Yeah, like what's important to you? Like, would you say that, I mean, your personal bond between two people is more important than patient care, things like that?
So, now that you have experienced fully the medical school, what advice would you give to someone who wants to be a doctor, aspiring to be a doctor in the future, and wants to apply for medical school? What advice would you give them in their application or in their preparation?
So I think my first piece of advice would be know what you're getting into.
Okay.
So I think that, I mean, if you want to apply for medicine, that's all well and good. I think that you should definitely get a good grasp of what being a doctor is like and see if it's really for you. So certainly, I mean, if you are confident enough, I mean, so when I did my medical attachment, I mean, it might surprise you to say that. I mean, like the juniors that you talk to always say, "Don't do it. It's not too late. You haven't applied. You're not bonded. Just don't apply. It's so difficult. You work long hours. You're so tired." And in the back of my mind, listening to them, I would be like, "Yeah lah, sure. Yeah, I'm sure if you all can do it, I also can do it. What do you mean? It's so easy." Just
so
be a
easy.
doctor and just earn money. So
Correct. Just be a doctor.
Just be a doctor, lol.
Yeah.
Yeah. So I mean, I think that's why attachments are important. So really understand what it's like. And then I would say, I mean, study hard. I mean, exams are important to get into the school that you want.
Correct.
And then I would say, I mean, look for help. I think the help is very important. In VJ in particular, where I came from, very few of our seniors end up doing medicine. It's really only a handful every year. Less than 20 seems to be about average. But so the resources that you have access to as a student from not Hwa Chong or not RIs or not ACJC is a lot, or ACSI for that matter.
Okay.
It's really a lot less. So try to find someone who has applied to medicine recently, who understands what the medicine application process is like and can help you guide you through it. I would say that this is probably, beyond grades, this is probably the biggest determining factor in how successful applicants are. In my second year, I mean, I was part of the Muslim Healthcare Outreach Program as well. I mean, of the students that I guided or mentored, I mean, 2 of them entered medicine. So I think that is very helpful. I mean, but to be fair, they both had good grades also.
Okay, so grades essential, but also this getting to know what's in store to be a doctor.
You need to know what you need to know.
You need to know what you need to know. That's very good advice, Mr. Ashraf.
So our final question will be something more simple. So how do you relax or unwind after a tough day at work?
Yeah, tell me.
Oh, I think that's changed slightly. It used to be where after a tough day at work, I would, after a tough call, sometimes I wouldn't eat. I wouldn't even shower. I would just sleep on the carpet, on the floor. And I'll wake up before Maghrib and then I would go about my day. Okay. But I guess, I mean, on a normal day when I'm not sleep deprived for 30 hours, then I will generally play games online with my friends. I think that, I mean, the most important aspect to me is the social aspect of it. I mean, just hearing human voices and just doing a task together and laughing and having fun. I think it's important. More recently, I mean, I spend more time with my wife, I guess, just spending time relaxing or watching movies and anime and sometimes playing games and stuff with my siblings as well.
Oh, this sounds like a very good work-life balance you have there.
Yes.
Final question. What's your favorite Dota hero?
I only, on the Dota character select map, there's only 2 heroes. So I don't really know what you mean.
I understand you perfectly. Okay, thank you very much for joining us and sharing with us. this your experiences as a doctor. We fully appreciate your knowledge and experience, and being our good friend. Hopefully, we hope that you can be a very successful doctor and help us when we are dying. Or not dying.
Or not die. Yes.
Or in Dota dying.
So, can you please shout out your social media so people can find you on social media?
Oh,
You don't have, right?
Actually, my social media presence is very, very bland. I mean, it's really just me and some cat photos. I don't think you have.
Thank you very much for listening in to the TMB podcast. This is Shaik, me Tooth-lah, he
And
Ashraf.
It's Ashraf. Yes.
Thank you.
Thank you.
Okay.
So, what was the first day after graduation working as a doctor like?
Oh man. First day. Let's see if I can remember. First day. Let's see. Excuse me.